It's Studio 11.
All right, more on this. Joining us now, Dr. Lauren Crosby from Lapeer Pediatrics. I remember when we first heard this story, the numbers, just a few people, 66. Are you surprised by that?
No, I'm not. I actually think it's going to keep rising. I really do, because I think that especially, we're talking about Disneyland, and that's in Southern California. California in general has a higher rate of non-vaccinators. So I think that that kind of brings part of it to a head.
That's the bigger issue.
Here in
that is the bigger
California.
issue. And let's talk about that, because
Yeah,
non-vaccinators, this disease, this virus was almost nil.
In year 2000, it
until
was
about
declared
10 years
eradicated.
ago, right.
Yeah.
And then do you credit or discredit, if you will, the people who refuse to get their kids vaccinated with the reproliferation of it?
Yeah, I think most physicians do. I think the CDC does as well. I think the Department of Public Health, also in California, will agree to that. Because the initial cases, most of them were in unvaccinated. Some were in kids that were too young to receive the vaccine. The first vaccine dose can be given on or after the first birthday.
Right.
And then after one dose, you have pretty good immunity in the 90%, but after two doses, about 98, 99% immunity. That still leaves 2% that, could get it, but certainly decreases your risk a lot.
Not all of us have gone to Disneyland recently. Should we be concerned? I know you're getting calls at your office.
We are. I mean, most of our calls, because our patients pretty much, they all have their vaccines or want to get their vaccines. Some of them will delay it a little bit and say, oh, I'll come back for it. And then when that happens, I try to discourage that. They forget to come back. So that's a problem as well. So we are getting a lot of calls. Did I come back? Am I up to date? Can we come and get it? Do we need an extra one? Can you give it to the parents?
Well, so to that extent, do you think that this scare, and it's only, 60 some odd people, but do you think this scare is a good thing generally?
Yeah, I actually do. I said that to one of my colleagues. I said, this may be, it's sad because obviously I don't want anyone to suffer, and there can be deaths from the measles. 1 in 1,000 can die. So there are complications from it. But I think this brings it more to a forefront where people are going to start really realizing this is a real thing, and that if we don't have more immunity in our community, the herd immunity as it's called, the more immunized, the less chances that it will spread and continue to spread. I mean, the child in Mexico was a 22-month-old that picked it up at Disneyland who had not had a vaccine and now is taking it back to Mexico. Don't know what's going to happen there. So, travel, and Disneyland's a perfect place for this because it's a tourist
and
spot.
Airplanes even
Airplanes,
better.
absolutely, because it can sit in the air for 2 hours. Even after someone leaves the room, it's the most highly contagious virus.
And children and parents equally at risk?
Yeah, I mean,
Adults?
Kids under the age of 5 can get sicker, or adults over the age of 20 tend to have a harder time with it. 1 in 20 people can get pneumonia from it, and 1 in 1,000 encephalitis.
Encephalitis being?
Inflammation of the brain that can lead to brain damage, can lead to seizures, could put you in a coma, could cause some very serious brain problems.
And in rare cases, death.
Rare case, 1 in 1,000, same risk as encephalitis. So it's real, and that's why people need to make sure they have immunity. People don't know, especially people born in the 60s and 70s, they should go and get blood tests and see if they have immunity or not. And if they're not immune, they can get the vaccine.
You're giving me that look. Christine, do you know?
Christine? Yeah.
Well, and if you've had German measles, the 3-day measles, does that make you? It's not.
It's not the same. So they're different. So if you've had that, that doesn't mean that you have immunity to actual measles.
I don't
they're
think
different.
I don't think they kept records back when I would have gotten vaccinated.
I know.
So I better
That's
check.
why if you're not sure, it never hurts.
Get a blood test, right?
Yeah, it's just
exactly.
a blood test. It never hurts to just make sure.
All right, Dr. Crosby, thank you very much. Lapeer Pediatrics for being with us.